All right, well, good afternoon, everyone. I am just so thrilled to be here at UMass Chan, a fantastic asset for the state, a gem alongside UMass Memorial Medical Center. You guys are fantastic. So happy to be in the heart of the Commonwealth. Thank you, everybody, for coming out. I want to thank President Precourt. I want to thank President Eric Dixon and the team here at UMass Memorial. We could not be more proud of this healthcare system, this gem in the heart of our state. Chancellor Collins at UMass Chan Medical School, one of the best research institutions in the entire country. I'm delighted to be joined by our new Secretary of Economic Development, Eric Paley, who is making sure that we are leading when it comes to investing in science, research, innovations, all things that really power the Massachusetts economy. I also want to introduce Jonathan, who you're going to hear from in just a little bit. I got to tell you, that was a really powerful visit that we had, Jonathan, and I look forward to you having the opportunity to share your story and talk about the incredible work that goes on at this institution. I also want to thank Jan Czerny, for talking to us, who was among the treating providers, physicians of Jonathan during what has been a remarkable journey. So thank you as well. So I just got to tour and see the Cancer Center here at UMass Memorial, which is one part of this incredible hospital. I learned earlier all about CAR T cell therapy, which, for those of you who don't know, CAR T uses a patient's own immune system to fight cancer. It's incredible. It's advanced, it's cutting edge, and it's only available in facilities like UMass Memorial. Facilities that have the research and the talent and the know-how to deliver. Importantly, it's also rooted in research and clinical trials. The incredible success of Jonathan and 35 other patients who've received CAR T therapy right here and who are just miracles and living success stories also represent not just the incredible work of caring doctors and nurses and staff at a facility like UMass Memorial. It also represents the power and the importance of research, of science, and the investments that we need to make both as a state and a country in science and research. Patients with very scary diagnoses can now come here and get their care. And I talk a lot about this. It's about hope. It's about hope. And you all work together every day to provide hope, to give hope. And it is so important that we do everything to maintain hope as we move forward with innovations. The result is really remarkable. And as I say, I met Jonathan when he was a younger man. He's young now, yes. Though proudly studying at Worcester State University. But when he was younger, back in 2016, he was diagnosed and faced some really hard years. But through his treatment and all of the research that went into it, his cancer is now in remission and his life is moving forward. In addition to cancer and blood cancers, CAR T is now being researched for treating things like lupus and myeloma. And UMass Memorial has more than 200 other clinical trials underway on many other cancers and conditions. This is what UMass Memorial does. This is what Massachusetts does and is about, and we're so happy for that. I want to also say a couple things about Massachusetts while we're on the topic. We know that science saves lives, and from the beginning, Massachusetts has been a place that's invested in education, in science, and research, and know-how. I'm proud to say that as we stand here today, Massachusetts is ranked #1 in innovation, in healthcare, in education. We've been named the best state to have a baby, to raise a family, even to retire. We also have the best health outcomes for folks. I was walking in and I was meeting people who were on their way into infusions. I met a woman who moved here 4 years ago, stage 4 cancer. She's here receiving treatment and doing incredibly well, and appreciates, as I do, the incredible work that goes on here. I also want to say that this innovation is what drives our economy. You know, we did a look. UMass Donahue Institute recently found that $8.6 billion in annual federal research funding supports in Massachusetts over 80,000 jobs, nearly $8 billion in income, and generates more than $16 billion in economic activity for our state. It's a big deal. It's a huge economic engine and driver for our state. Research funding means jobs, means growth, means a better economy. For every dollar invested in research in Massachusetts, we see an economic benefit of double that amount, just in terms of dollars. But the benefit given to patients like Jonathan and his mom and families out there, that's priceless. The UMass Memorial System alone employs 21,000 people across this region. In addition to economic opportunity for people in life sciences and healthcare, remember that those investments also drive the construction jobs, the real estate jobs, the hospitality, the retail jobs, all the restaurants and coffee shops that benefit from this incredible collection of talented people going to work every day. Not to mention all the folks in the supply chain, supplying services and parts for this kind of work to take place. So that's why in Massachusetts, we don't cut funding for medical research. We actually invest in it. It's why our Economic Development Bill, the Mass Leads Act, reauthorized the Mass Life Sciences Initiative for another decade of innovation, including right here in Worcester, which is now back in the top 20 in the entire country as a life sciences hub. We know it's something special is happening right here. It's also why this summer I announced the Massachusetts Drive Initiative. Discovery, research, innovation for a vibrant economy. Drive. This is an incredibly important act. It's an incredibly important piece of legislation. We're bringing together leaders from science, healthcare, education, and industry to develop a long-term strategy for our state. Drive also includes in it an investment of $400 million in research and innovation for our ecosystem right here through projects that provide public benefits, good jobs, and medical advances for patients. So this isn't just about filling gaps left by what has been devastating cuts at the federal level. This is actually about designing something that will continue to be a catalytic engine for our state. There's no better state to bet on than Massachusetts when it comes to innovation, when it comes to powering technology, and when it comes to leading in healthcare. So that's what we're doing here in the state. And as I said, the federal administration is not helping us right now, either because they don't understand the value of science, the value of research, because they've continued to defund medical research right now and do other things that undermine public health, in my view. But in Massachusetts, we're going to move forward. We'll never turn our back on science or on public health or on getting people access to the care, the treatment, the medication that they want and need. That includes vaccines, which is why I was proud last week to be able to stand up and say, in Massachusetts, whether you want a vaccine for flu or RSV or COVID, or you want to make sure that your child has the vaccines for chickenpox and measles and mumps, you are going to get it in Massachusetts. You will continue to get it in Massachusetts as long as I am governor. And it's also why we're here today to tout and advance this Drive initiative. It's so important for the state that we make these investments, and I'm incredibly grateful to all who work in these fields to make it happen. And when I think about Drive, the thing that I think about and why this legislation is so important, and we got to act to pass it now. People's lives are depending on it. Families are depending on it. They're looking for it. And it's something I know we can deliver right here in Massachusetts. And with that, I'd like to turn it over to my friend, who's been an incredible leader for this institution and for Massachusetts, Dr. Eric Dixon.
Thank you, Governor.
Thank you.
On behalf of Chancellor Collins and myself, we'd like to welcome you to what is an amazing healthcare research ecosystem here. The state's only public medical school behind us, the only academic medical center outside of Boston. This is a place, a very special place, where discovery and clinical care come together, and where diseases that were previously uncurable are cured, and people that had no hope get hope. To be able to do the things that we do here, it requires partnership, like the amazing partnership between the school and the healthcare system. It requires trust from our patients, like Jonathan, who you'll get to hear from in a minute. It requires the trust of people that enroll in our clinical trials, and it requires support. It requires support at the federal level, especially, and at the state level. And lately, that support has not been forthcoming. And so this amazing ecosystem is in trouble if we don't find some way to keep going the amazing research and clinical care that is occurring here. And so that's why I wanted to have the governor out and thank her personally for the DRIVE initiative, which Quentin will be in charge of implementing, if we can get this passed through the House and the Senate. And so it's not a sure thing. And so what I would urge all of you and all of our patients to feel free to call your representative and your local senator and pledge your support and ask them to support the DRIVE initiative so we can keep the amazing work here that's going on at UMass Memorial and at UMass Chan and across this incredible state going. Thank you, and let me turn it over to my friend and colleague, Chancellor Collins.
Thank you, Dr. Dixon. Thank you very much for including me in today's event. Governor, welcome to UMass Chan and UMass Memorial. I want you to know how grateful we are for your advocacy and leadership in the healthcare, higher education, and science communities, which at this moment, frankly, face unprecedented challenges and uncertainty. Governor, I know you've had the opportunity to witness firsthand the real impact of hope, because research brings hope to the human condition. And cutting-edge research, experimental clinical trials, and novel treatments are a renewable source of hope for patients and families who desperately need it, especially if they're confronted by a serious condition. Since taking office, Governor Healey has recognized the importance of biomedical research and the broader life sciences ecosystem in the Commonwealth, and her administration has acted shepherding the Massachusetts LEADS Act through the legislature and reauthorizing the Massachusetts Life Sciences Center for an additional $1 billion of investment. She speaks of the importance of innovation and creativity in Massachusetts, and she acts on it. Now, as we face significant headwinds from Washington, the governor has once again stepped up to lead. Her DRIVE initiative would provide much-needed funding to research-intensive institutions like ours at a time when detrimental funding interruptions are occurring, and they are actually bringing a crippling uncertainty. The DRIVE initiative recognizes that as the federal administration wavers from its decades-long commitment to support of biomedical research, that our nation's research enterprise could face irrevocable harm and hardship. It will mean that life-saving research, like you'll hear, research that has made Jonathan's life so incredibly much better, research that brings hope to the human condition, could be sidelined. It will mean an entire generation of emerging scientists will seek other careers or countries. And I can tell you just about daily, folks who populate our labs come up to me and say, Chancellor, have I made a mistake by deciding to go into science full-time? Now, all of this runs counter to what our governor is and what she's all about. Governor Healey believes in the promise of research and medicine to alleviate human suffering. She believes in scientific progress. She believes in public and preventive health. She believes in vaccines. Our governor believes in American ingenuity and the Commonwealth's life sciences community. In short, Governor, you believe in each and every one of us. And that is why she's not going to wait for the federal government to get its act together. She intuitively understands that if we wait, that's tantamount to waving a flag of surrender. Governor Healey is extremely competitive, and she reminds me of this regularly. And she's not going to lose on this matter. What Massachusetts is able to build is a partnership with the federal government over the past 50 years, and that partnership should not be destroyed by partisan politics. At UMass Chan, we're committed in principle and in action to working with her administration, the legislature, and other key stakeholders to advance the Forward-Thinking Drive Act. Governor, on behalf of a grateful institution, we thank you for your bold and inspiring leadership.
Thank you.
Thank you. And it's now my privilege to introduce the co-director of the Blood and Bone Marrow Transplant Program, Dr. Jonathan Czerny. Dr. Czerny.
Hello and welcome to UMass Memorial Medical Center. My name is Jan Czerny, and I serve, as you have heard, as the co-director of blood and bone marrow transplant here at UMass Memorial Healthcare. And I also have the distinct honor of being physician to brave men like Jonathan Tomaszewski is. On behalf of the entire hematology-oncology team, I want to thank the Governor Healey and her team for visiting us and learning about the important discoveries and clinical advances that are happening around us. I would like to share a little bit of story about CAR T cells, and I would like to also share how it connects personally with me. I have lost my mother to terminal cancer a few weeks after enrolling into medical school. Her treatments were harsh, but that was the best we had. There was no supportive care. There was no additional nursing care available. The treatments didn't work, and my mom still took them because there was nothing better that she could do for her son, not to see her die when the son was young. I have learned to use the experience and drive my motivation and never ever rest so that patients that eventually I will be taken care of do not have to unnecessarily suffer, that we design care that is smart, that we design care and treatments that are personalized and personal. I have no problem with that, and provide the least amount of side effects necessary. That is because what I have experienced pretty much firsthand. I graduated medical school magna cum laude. I have enrolled in various research activities since very early in my career, even as a medical student. I have tried every single specialty within medicine because all of those were teaching me how to be a better person, how to be a better clinician, and how to take care of my patients and their families better. Now, dial forward back many years, and here we stand at UMass, where we, thanks to the leadership of our governor, thanks to the leadership of our chief executive officer, Dr. Eric Dixon, and Chancellor Collins, and others, we can actually administer care that is cutting edge, leading treatments within the oncology field that takes care of diseases that we thought incurable up until now. We certainly have our challenges, and the research needs to go on. And you will soon hear amazing story of a patient who has received many years of therapy similar to my loved one. It didn't work, and then here we are several years later. We have found the right treatment. We were able to deliver it thanks to our team here standing here with us. Let me tell you something about how CAR T cells work. A patient has progressive disease, progressive cancer, and their immune system is no longer recognizing that something is wrong, that the immune system should be responding to an emergency. We collect those patients' specific type of white cells called T lymphocyte. T, because thymus is the school where those cells should have learned how to deal with such an invasion of danger into the human body. We sent those cells to sophisticated laboratories, either in a pharmaceutical company, but those could be actually at our campus. And those cells are modified in a way that they now recognize a target very unique to the cancer cell, that they amplify and activate upon contact with this target. And it is actually this expansion that may make our patients very, very sick. Sometimes they need to go to intensive care unit, but thanks to research, since 4 years ago, we have now learned how to minimize these episodes and events from happening. And we can mitigate those, I don't like to call them side effects, like to call them treatment effects. We can prevent patients from going to intensive care units. We can minimize this to the point that we are actually now in discussions how to bring treatments to the outpatient level of care and provide this cutting-edge treatment to patients so that they can go home, sleep in their own bed, and come back see us the next day. We are also, thanks to involvement in clinical research, looking into how to make these treatments more efficient, more effective, more economical, and how we can make them safer, because there are still some side effects and patients still need to come see us every so often. We are embarking on research within blood cancers. We are embarking on research within solid tumor oncology, and we are already treating patients with autoimmune disorders, as you have heard before, patients with lupus, patients with scleroderma, and patients with neurological disorders. This treatment is truly cutting edge. This treatment makes me proud of what I have done with myself, with my career, because we are doing what once I have sort of promised to myself, what once I have promised and dreamt about, and it is possible because of the people standing behind me, around me. This is the place to be treated for these diseases. With that said, please let me introduce to you a very young and very brave man from our community, Jonathan Tomaszewski, who allowed me the privilege to be his treating physician. Thank you so much.
Good afternoon, everyone. I just want to thank everyone for being here, especially Governor Maura Healey. So it's an honor to be here speaking with you all today to highlight the incredible care patients like me are receiving thanks to the effort of researchers, physicians, and caregivers like those at the medical center. My name is Jonathan Tomaszewski, and I'm proud to be standing here today to tell you that I have been in remission from acute lymphoblastic leukemia for almost exactly 3 years now. For those who may not know, ALL is a blood cancer. I was first diagnosed when I was 17 years old. At the time, I went through an initial treatment plan of chemotherapy and steroids for about 2 years. We thought the cancer was gone, but in 2019, I underwent a bone marrow biopsy, and testing confirmed my worst fears. My cancer was back. This time, it was in my cerebral spinal fluid, which meant chemotherapy would not be as effective of an option. I went through a rigorous treatment plan, but once again in 2021, I found out that I had relapsed for a second time. The cancer was impacting every aspect of my life, from missing school, missing time with loved ones and friends, even impacting my ability to walk on my own. But thankfully for me, and so many patients like me, by the time I experienced my second relapse, UMass Memorial Medical Center had just started introducing CAR T-cell therapy as a treatment option in the fight against blood cancers like mine. I was one of the first patients to undergo this treatment here in 2022, and it quite literally saved my life. If not for the work of researchers, their access to critical funding, and the ability for hospitals to have access to this therapy, lives would surely be lost. I was able to walk again. on my own in just a couple months after undergoing CAR T cell therapy. And 4 years later, I'm proud to share that at almost 26, I'm now in my senior year of college at Worcester State University studying communications. Maybe my professors can cut me a break from missing class and being here today and give me a little extra credit too. I don't know what my life would have looked like without CAR T and my care team, but thankfully I don't have to. As I look around this whole room of people and doctors, I see so many people who have been with me on every step of my journey as a patient here. Seeing you all in one room means the world to me, and I feel so lucky to know you. I think of my infusion team as a second family. My mom is also here with me, and she would agree. Thank you all, not only the clinical care that brought me here today, but for caring for me as a whole person during this journey. Thank you all very much. Thank you. Thank you very
Great.
much.
I'll tell you what we're going to do. First of all, there's a fellow behind you. His name's Quentin Palfrey. I meant to introduce him earlier.
Hi,
He's our
nice to meet
Director
you.
of Federal Funds, and he's helping us literally drive forward this DRIVE initiative. Your communications major.
Yeah.
We'll see. Do they have any questions for you? Here we go. Any questions? Any questions for Jonathan?
I want to work in a medical field in a hospital maybe, and maybe be an advocate for patients and family to really talk about this immunotherapy I received and show how amazing and groundbreaking it is, and to show how healthy I am now at almost 26 years old.
When were you first diagnosed?
I was first diagnosed in December of 2016, December 15th, 2016 to be exact, and good.
How did it make you feel to get that news?
I think it was very, scary at first, and we had so many questions and unanswered things to know, but I think over the years, it was scary to have multiple relapses, but I think I gained, and my family gained more knowledge on everything, and it brought me to where I'm at in my life right now, and getting CAR T cell and having that immunotherapy to, save my life. Does anyone have any other?
Well, you've more than earned your extra credit for the
Yes,
job.
thank you.
I'm trying
Yes.
to do something. This is the part where I get
Yes,
it, but they maybe
thank you.
hammer me. But, I also want to recognize our good friend and well-known to the entire Commonwealth, but especially here in Worcester, Karen Polito. Thank you for your continued service in the state. So, any questions on topic?
Yes. Quick question. Considering how the State House and State Senate move sort of at its own pace, and you have made very clear the need to pass this legislation, what is your message to state leaders right now to get to your desk on time, or just how fast do you want it to get there?
As soon as possible. I mean, we need this to happen. We need this to happen now. This is a priority for me. This is a priority for Massachusetts. This is something that we need to do. And time is of the essence. And it's of the essence for a variety of reasons. One thing is, and I mentioned this earlier, the reason, folks, I'm doing this, $400 million we're going to invest in science, in research, in innovation, because it's an important economic driver for our state, and it is the only way that you end up with Jonathan having the success that he does today. Were it not for the studies, the research, the clinical trials that took place years ago, these things don't come to life. And so when the federal government decided to cut NIH funding, that's devastating, because anything that puts a pause on research, we end up losing decades of research and decades of results. Chancellor, correct me if I'm wrong, but our Nobel Prize winners, by the way, we have 2 from UMass, okay? This is why we're an important epicenter for all of this, not just for the state or the country, but the world. What's the trajectory on those things? When did Craig first study
The
it?
science for Dr. Ambrose was published in 1993. The paper from Dr. Mello was in the 94 timeframe. And Craig got his Nobel in '06, and Dr. Ambrose got his Nobel in 2024. So you can see that the science that's being done today are the Nobel Prize discoveries of 20 to 30 years from now. And if there is a lack of commitment to the outstanding people that we're able to recruit to our campus, and that Dr. Dixon is able to recruit to our clinical research efforts, the possibility and the hope that they will bring through their discoveries will be diminished. That's why I believe the governor is completely right on this, that the funding is needed now. If the funding is not provided now, then we're going to have to let more people go. We're going to have to, the point that I made earlier about folks asking me almost on a daily basis, did I make a mistake by going into science, is not something that you want your best and most talented and highly recruited investigators to be thinking. Now is the time for us to be doubling down on research. If we weren't having these cuts right now, to be truthful, we would have so much research, we would have to have additional facilities. And in fact, now what we're doing is we're trying to figure out how we're going to keep the ones that we have full. So it's a very, very, very tenuous moment. And this is, by the way, across academic medicine across the country. But we've got a governor that gets it. We don't have to be begging her. We don't have to be going in there and trying to convince her. And now what we need to do is to get this DRIVE initiative underway so that the funds can be brought to the researchers as soon as possible.
Yeah. And I'll let Secretary Paley also add, but you asked about timing. This is a top priority for me as governor. It is something that needs to happen now, because every day, every week that goes by, we lose, first off, jobs, we lose opportunity, we lose hope. I'll also say this, there are some things that take a while. Research, it may take a few years, it may take a decade, it may take a couple decades to see the actual treatment delivered to save a life. But I can tell you right now that in the state of Massachusetts, we have people who are on the cusp of discovering the cures for ALS, for Alzheimer's, incredible innovative treatments for cancer that are life-changing. The exponential rate of growth in discovery is like something we have never seen before. That is why time is of the essence. It's happening here in Massachusetts. It's not happening in every state. It's not happening in every country. So we have an opportunity as a state. This is a huge economic catalyst. It is a huge economic engine. It is about jobs, and it is about hope. That's why I asked the legislature to act quickly on this. It is the right investment for our state. It is the right investment for our people. And I'm going to continue to work with the legislature to get this over the finish line as soon as possible.
So, $400 million, half of it from the stabilization fund, half of it from the millionaire's tax. Given the tight budget in the state, do you think lawmakers are going to go for this?
Well, let me just clarify. Half of it comes from revenue from the surtax. And remember, taxpayer dollars are supposed to go to important investments in things like education and transportation. And so we're going to take a portion of the money that's for education and actually use it for our education institutions, our research institutions. That makes a lot of sense to me. The other part of that comes from our interest in excess capital gains, and also from funding that let me correct that, Brett has stated, okay? The other part of that will come from federal funds that we had already set up a fund for with the Biden administration. My first couple of years as governor, I brought back $9 billion to the state of Massachusetts that we plowed into all sorts of things: education, infrastructure, housing, transportation. We have that sitting there. As you may have read or heard, we are not, and states are not, getting funding from the federal government now. Instead, we've seen cuts to veteran services, to housing, to food, to transportation, to education. So let's use that in a smart way now to put into our own people, our own research, our own innovation economy. That's where the money comes from. The money is there, and I think that this is a great ROI for taxpayers in Massachusetts.
Anyone else?
Yep. He's got a little bit more, sorry. Yeah. Yep.
What else is the administration looking at here? Because Telegram has reported from UMass Memorial Health that big beautiful bill that potentially faces a $200 million annual loss with the proposed, with the NA indirect funding cuts that are still being litigated. The medical school stands to lose $40 to $50 million annually. And that's just these two institutions. So statewide, the shortfall is much bigger. What other initiatives is the administration looking at right now to potentially introduce to constrict that gap?
Yeah. Well, I guess let me talk about a few priorities. I mentioned DRIVE. DRIVE is very important as a matter of economic investment and growth for our state. DRIVE is also a jobs bill for our state. The other thing that is important for the legislature to act on is shoring up the health safety net. We need to make sure that facilities like UMass Memorial, which are the safety net hospital for central Massachusetts, have the funding they need to enable people to continue to access care. And yes, the Trump administration made it a heck of a lot harder through the big beautiful bill in Congress that is taking away funding for hospitals and healthcare centers. And so that's why it's important that we act quickly in the state to shore up our healthcare delivery system, and I'm going to continue to work on and lean into that. And also, I'm going to continue to lean on every single day. You know this. My focus is on how do I drive down costs for people in this state. We're number one in education, healthcare, innovation. We have so many great things going for us. We also have challenges, and that is why I've leaned big into housing. 2.5 years ago, we were short 220,000 homes in Massachusetts. Because of the actions that I took, because of the work of our administration, because of the work that we did with the legislature, we now have tax credits out to developers. We have made permitting changes. We have made policy reforms. And we've got 90,000 homes that are being built now, underway, towards that 220. So every day is about building more homes so we can drive down housing costs. It's about bringing more energy online. I advocated recently for bringing more energy into Massachusetts, including gas. We've got to find ways to lower people's bills. And finally, on healthcare costs, how do we drive down the cost of healthcare? And that's something that I'm very focused on. So, I'm pleased that we're able to talk about this important piece of legislation today. It is so important, but making life better, easier, more affordable for people is what we're doing. By the way, you should let people know through the work you do that yesterday I made an important announcement. Not only did I cut taxes 2 years ago, I also cut a bunch of regulations a few months ago. And yesterday, very important, I've eliminated state-level environmental review for housing development that'll speed up the time of housing. Instead of taking a year to get through an environmental review to build housing and get that permitted, we shrunk it down to 30 days. And in some cases, we've eliminated it altogether. So less time means more cost saving, and those are some of the things that we're focused on. But again, I just want to say huge thank you to UMass Memorial, to Dr. Dixon, to the entire team. I want to thank Chancellor Collins for the great work that continues to go on at UMass Chan. Thank you to Quentin Palfrey, Director Palfrey, and Secretary Paley. And thank you to all of those out there in the field who are doing the work. I say that, despite anything that's happening in D.C., Massachusetts, we are open for business. I want every scientist, entrepreneur, researcher, not just in this country, but around the world, to come to Massachusetts and to study and to do work and start companies and grow businesses here. So I thank you for coming, and I want to end by thanking the star of our show, Jonathan Tomaszewski, for telling your story, sharing this story. This is what's special about Massachusetts. This happens because of the investments made. And how can you better state the results of this? And by the way, he's in good company. He was the miracle a few years ago. There's now 35 people. They are 35 for 35 in successful CAR-T infusions. Amazing. And that's part of the Massachusetts record here, and why that ROI is a sure bet to me. That investment, I know, is going to pay off for so many people around the state. Thank you very much. Also, Secretary Paley's available. You should get to know him. He's our fantastic new Economic Development Secretary. I'm sure he'd be loving the opportunity to talk to you. Okay, thanks, guys.
Thank you.